Next topic we're moving on to is the rise of COVID, and specifically the completely muddled policy that we've seen all week in regarding to the app pinging on people's mobile phones, alerting them that they've been in contact with somebody who's been prescribed as COVID-19 or one of the variations of it. But specifically, we're going to focus not nationally in this slot, but on the southwest, because the southwest has been identified, Dorset, Devon, Cornwall, that sort of area, has been identified as one of the fastest growing. So even though it hasn't got huge numbers of people with COVID, it must be recognised, of course, that the population is a lot more sparse in the southwest because it hasn't got many built-up conurbations, with Exeter, Plymouth, probably being the two largest. If you build in Bristol as well, they're probably the largest, but they don't really compare to some of the major cities. So when people look at the figures, they shouldn't think, oh, there's not really a problem here, because they have to remember there's a lot less people. And as the government data suggests, that the growth rate at this point in time, the southwest is one of the highest. As you can see from the government data here, you've had the R rate now has moved from 1.2 to 1.5, and the growth rate percentage per day from 4 to 8. So it's doubled, which is dramatic. And we don't need to go through this. People can just go online and check out government website and the guidance around COVID and the statistics. But what I want to focus more on in relation to the southwest is some of the articles and information that we've had on Dorset Eye. For example, if we look at the conurbation in and around Bournemouth, Christchurch and Poole, it's now among the 3 worst UK hotspots for COVID. And why is that? Significantly because of tourism, people coming down to the beaches, the size of the populations in those 3 areas of the conurbation expanding dramatically, obviously with the hot weather and the attraction of the coast. So those particular populations, and I see many of them again on social media, complaining by the fact that, they live here, they've done everything they're supposed to be doing. Suddenly the economy's opened up. Suddenly the tourist areas in and around Bournemouth, Christchurch and Poole have bloated, and now the chances of them getting COVID are significantly increased through no fault of their own. So that's obviously an issue, and it needs to be taken account of. And when we talk about putting the economy over health, we have to realise that when we put the economy over health, it then has a dramatic effect upon health, which then has a dramatic reverse effect back on the economy. So it becomes a vicious circle. So people sort of saying, let's tick a box and say the economy is more important than our individual health. They really need to think this through. And we've got public services being affected, of which this is just one, where we have the BCP now have found that a lot of their staff employed for refuse collecting have been pinged, and as a result of being pinged, they've gone off work. And we've seen this in the news cycle over the last 3 or 4 days in terms of retail, in terms of food and stocking shelves in supermarkets, in terms of lorry drivers being able to get food to supermarkets. A whole number of different institutions and different services have really, really struggled. And then you have a government minister coming on this morning, which we've got an article on the site, which I won't go into now. He's in almost virtual denial that these supermarkets across the country have empty shelves, and saying it's just in little pockets around the country. Well, I know for a fact there's 3 supermarkets on my doorstep where the shelves are virtually empty. And this is, an area where lots of tourists are coming in. And there's suddenly, as I say, there's a much more bloated population. So demand goes up. And at the same time, supply isn't matching it. In fact, supply is falling well short. So here we have, again, holidaymakers and the sort of indigenous local people of the population in the area both of them now in a real struggle in order to get basics. But if we then revert back to the ping discussion, which was, all over the news, and as I said, it was first highlighted by the BBC at the beginning of the week. We aren't met with a government that's perceived to be good at planning. We have a government that's constantly being criticised and making up on the hoof, and we have a government who seems to be most of the time pandering to the rich donors of the Conservative Party, completely over the interests of the rest of the population, knowing that there's not a general election around the corner to 2024. And it's also interesting to see the polls that have come out this morning, which people were incredulous at in the last few weeks and months, saying, how the hell can the Tories still be that far ahead of Labour, given the pandemic and the crisis? Well, we know why the Tories are so far ahead of Labour. It's because we have a leader of the Labour Party and a shadow cabinet who, when it comes to measuring their value, you need a microscope. And even then you're struggling. So that's why they haven't got a strong leader, they haven't got a strong principled person, but we don't need to go into all that now. So the Tories have effectively been let off the hook. But their ability to plan, their ability to reassure the public in practical terms is now almost completely zilch. And as I said before, the essence of the election being 3 years away means that they are well and truly off the hook at this time, because there's nothing we can do about it.
Yeah, and they're 80-seat majority, so they can vote through anything they want to vote through, and they are doing. Yeah, very worrying. Yeah, I mean, there's lots in what you say. Obviously, the picture is very worrying again. The Delta variant's running wild. The government, since the government Johnson made his announcements about Freedom Day, it's just a ridiculous term in the first place.
But on Twitter, it was called Freedom Day.
Freedom Day, yeah. I mean, obviously, a stupid populist term, but also a term that gives people completely the wrong idea. So it's dangerous. And so when a couple of weeks ago he made his announcements about, no longer mandating social distancing and mask wearing, he didn't originally do so with the strong, scientific and sort of medical public health message that people still should socially distance and wear masks in certain instances, indoors, etc. It was all a message of freedom and the end of lockdown measures, and they get called restrictions. I'm always interested in semantics. It's fascinating. They get called restrictions, lockdown rules, and we don't like rules and restrictions, so we celebrate their lifting. That's a very deliberate ploy. So they're deliberately called restrictions. They're not called preventative health measures. Yay, we're getting rid of preventative health measures. Yeah, that sounds a bit different, doesn't it? That sounds a bit dumb and dangerous. So there's important things to recognise about the semantics being used and how the public respond to those words. But the truth of the matter is, yes, we're getting rid of the government mandate for preventative health measures that saves lives. But the important thing was that, he has reeled back to some extent over the last couple of weeks by saying that public health message that people still should. But by then it's too late. People hear the first message, and as always, the government know this, they put something out that's untruthful or incorrect or gives people a certain impression. They deliberately put it out there, then they reel it back or say something slightly different, knowing that half the population will only hear or read about the first thing and tell each other and post on social media about the first thing. So many people have said, yay, we don't have to socially distance or mask wear anymore. That's not what was being said. That's not what's happening. What's happening is the government have removed the legal mandate for those things that come with punishment if you don't. That's what they've removed. But the message is still very much that people should socially distance and mask wear in those sort of situations where they're indoors, on public transport, unable to socially distance, etc. So, and
if you're in a position where you have a 44% victory in terms of the coverage of the electorate at the last general election, and you have 56% who voted elsewhere, the only thing that leads the 56% to agree with the government is when they're forced to by law. So you bring in the restrictions, and the restrictions can be across the board, you know, in terms of going out of the house, in terms of going to the workplace, in terms of using public transport, accessing your local A&E, or whatever it might be. They are molding your behavior. You have no choice unless you want to break those restrictions, break those laws, which then lead on the one hand maybe to criminalization, but on the other hand, certainly for the middle classes, they're just as worried about how it makes them look in the public. So if it's reported in the press that a particular person has contravened these rules and regulations, then often they're much more worried about the social perception, or they're as worried about the social perception as they are about getting a slap on the wrist from a local police officer. So we have to be also looking at human behavior. And in the Southwest, what we have is we have hundreds of thousands of tourists who've descended upon this part of the country, who've made that choice to leave their homes for whatever reasons, to come down to the Southwest. Now, if they're not abiding by the regulations that are in place before the 19th of July, that is mask wearing, socially distancing, then they're bringing that antisocial behavior. It's not on their doorstep. It's not their neighbours who are, you know, looking at them and tutting. It's a population that they might never come in contact with again, who's having to experience this. Because when you look on social media, most of the people locally, they blame, especially if you look at last summer, with all those issues around Lulworth. So many people, Poole, Bournemouth, Swanage, so many people on social media were saying, it's because we're being swamped by all these Londoners and all these people from Birmingham. They're coming down here, they're not doing what they're supposed to be doing, and then they're going home and they're leaving the debris behind. Well, the same sort of situation's happening now. Apart from this year, they're being given a serious green light by the government.
Yeah. So
we need to be understanding what it is about the Southwest and certain other places in the country that's leading to this outcome. And we haven't got any more time now, but I think the people in the Southwest really should be questioning what it is that's allowing large swathes of people to come down. Because as we talked about before, yes, the economy can grow, but at what cost? And if the cost is the contamination of local populations, eventually, as we're seeing with BCP, council and other key workers, etc., it has a dramatic effect on the economy. So it's about not allowing the government and their indecisions and their no planning and their contempt sometimes for most of us to let them tell us what to do. We need to be doing what's best for us, and we need to be uniting. So, for example, if it's not safe to go to the beach, don't go to the beach. If it's not safe to go into town and be commercial in terms of buying from shops, restrict the number of times that you go, etc., etc. If it's not safe to send your child to school, as a parent, you should be making those decisions. We should not be allowing government ministers to determine whether we live or die based on some ideological illusion that actually it will make the economy better and therefore it makes society better for us all, because it simply doesn't work like that.